Greetings of the season. I am Dr. Vijay Bharat. I am allergy specialist and asthma specialist practicing in Pune since last 25 years. And acute and chronic cases of asthma, allergies, practical experience along with doing clinical trials also. And last 25 years retrospectively and prospectively also doing a research in asthma allergy. See, as we all know, children's allergy is a number one chronic disease. Adults, every third person is suffering with some or the other allergy in India. And looking at the severity of the allergy asthma cases, the causes may be many. It varies from the adulterations, the artificial fertilization, pesticide use, to the indoor outdoor pollutants, vehicular exhaust, construction dust. The potency of the pollens has increased a lot. And because of this global warming and weather changes, the severe allergy cases have increased. So previously we used to just use oral and parental steroids to give a relief. But now the awareness has increased amongst the community. They don't want to have such type of side effect medications. So if you see the international national guidelines as well as my practical experience, the patients which are of a mild intermittent persistent, moderate to severe intermittent persistent allergic rhinitis, as well as moderate to severe asthma patients, then severe chronic urticaria, skin allergy patients, including eczema, and other like ocular allergies, rhinoconjunctivitis, we can say, sinusitis. Once the patient is in a chronic stage, established stage, or late phase, the usual antihistaminics don't work. And then we have to add on montelukast also to control the inflammation properly. And the routine dose of the antihistaminic also don't work properly. We have to increase the dose by 2 times or 4 times. For example, bilastine now, which is a very very good molecule for these refractory cases of urticarias, itchings, ocular allergies. Then even when the sensitization is more from the nose to the airways, the patients are already taking other antihistaminics. Then we increase the dose of bilastine because it is non-sedative, not blood-brain barrier crossing. It does not have an interference with the cardiac or liver or any other medications. So it's a very very safe, and it has a good long prolonged action also. Onset of action is also very good. And practically after using thousands of patients, my own experience, like I remember there was a very well-known surgeon, and he had been since many years having throat problems because of the Th2 inflammation, post-nasal dribbling, sinusitis, rhinitis. Already he had undergone one surgery also. And when we use this montelukast with bilastine 40 milligram, and he used to have a nighttime awakenings and blockers nose. In the evening time, before 1 hour before the food, we had a very good recovery. His inflammation was very well controlled. Nighttime, the dust mites into the bed as well as the pollens which come down from the ceiling level, and they trigger the patients. So that triggers also had gone down. So many cases we have used it, and this inflammation was very well controlled. Even in some of the patients, I have to use again after 8 to 12 hours, a 40 milligram of bilastine separately also to control these mast cells. So these safer, newer derivatives are practically very well useful in controlling these mast cells as well as underlying inflammation in these cases of rhinosinusitis, rhinoconjunctivitis, significant rhinitis, postnasal dribbling, upper airway cough, then again patients of asthma with underlying upper airway inflammation, rhinitis, then any ear problems also, repeatedly we can say otitis also. And then skin allergies, definitely it gives a very good relief to the itching as well as skin inflammation goes down even in the eczema cases. It should be used depending on the season. Like suppose some of the patients have a trigger into the rainy season. Then during that season, if they are exposed to the molds and all, then during the winter season, most of the patients have a trigger because of the pollens. So that time, maybe they may require 1 month, 3 months, and it can be given a prolonged period also. Adults and all, there are no side effects much. Even there is no sedation. Patients after consumption, they can have any like high risk jobs also, like somebody is working at the heights or somebody is driving. It's very safe, and they can have any place like swimming or anything. Nothing happens. Even some pilots, like there are many pilots, they are my patients. I have given Bilastin up to 80 milligram, and uh, they are driving the aeroplane, flying the aeroplane, no problem. So these safer medications should be utilized to control such type of inflammation and such moderate to severe allergy cases, as I mentioned about the different types of. Even some of the patients with a significant gut inflammation and underlying these hidden signs of allergy and comorbidities, we used to control the mast cells, and patients had a very good recovery for the gut symptoms also. And the newer problem about the rhinoconjunctivitis, it's a very big problem now. A lot of people are having a keratoconus, early age cataract glaucoma because of the repeated eye steroids, where this montelukast and bilastine, if it's given in a 40 milligram or 80 milligram, we found very good results. Those patients who had suggested for the intraocular steroids or even papillectomy, and along with some of the patients with the omalizumab, if the papillae were there, they did not require that. So even the ocular allergy, it is a localized symptoms of a systemic disease. And nose and eyes, they are always side by side. So 95% of the children always have a hidden ocular allergy, and 50% of them go into severe ocular allergies into the adolescent age or adulthood. Even angioedema patients, many of the patients have a lipedema, eye swellings or genital swellings after eating something or exposure to some dust and all. There also this molecule has very good results, and it can be used very well. So that awareness should be there, and the community should be given a benefit for such type of safer medications.